Hello everyone and welcome to Canine Dentistry. This is the first of a series of 8 sections in this course, and we are going to start with the introduction to clinical dentistry. This is the first of 4 images that I present to every single client with periodontal disease as a presentation for their pet. And if you'll notice, the gingiva and the teeth themselves look really normal. There's a periodontal probe inserted here adjacent to this tooth, and it represents a normal probing depth. And when you think about the patients that come into your practice, they are not in this category. They don't have the absence of disease. They have pretty much significant disease that is present in the form of calculus and gingivitis. If they weren't in that category, they're not going to be on your table undergoing a dental procedure. So this is an excellent set of images to present to clients to demonstrate the difference between what looks absolutely normal and what their pet presents with, which would be calculus and gingivitis or worse. So when I'm talking to a client with this set of images, the approach is, hello, Mrs. Simpson, this is a picture of a patient that we saw in our general practice years ago that came in for something other than dentistry. Very frequently, if we had time, we would take our periodontal probe and look for abnormalities in our patients. And in this particular case, even though this patient looks really nice and normal, there is a problem here, and we'll look at the radiograph or the x-ray in the next slide. All of this area that you see here that's darker than the surrounding area is where the bone has been destroyed. This is somewhat normal bone here, and when we look at a darker area adjacent to that normal bone, we can expect that that's bone loss or the destruction of bone secondary to periodontal disease. And periodontal disease starts with plaque. Plaque is a film that houses a population of bacteria that cause inflammation in the gum tissue initially, and that inflammation progresses and eventually causes destruction of the attachment of the gum to the tooth, and eventually gets down to the bone level and starts to destroy the bone, and that's what we're looking at here. Now, this looks like there's nothing there because it's just a black void, but in reality, what we have is a lot of infected tissue here filling that area where the bone's been destroyed. So here is the level of the bone at its highest point, and as you can see, the roots are somewhat exposed here, but this image doesn't really depict the true reality of the destruction. If we look at the same area after we've cleaned that out, we can see that there's significant destruction of the bone around that tooth root. And obviously that's an extraction. And Mrs. Simpson, if Fluffy has this same amount of bone destruction, which we generally expect with our patients, we will need to extract that tooth. And if there are multiple teeth there, we'll need to extract multiple teeth. We almost never have a patient that comes in, especially with a level of calculus or tartar and gum inflammation or gingivitis,